When we talk about mental health, it's pretty common to think about risks piling up, right? One condition plus another, it just feels like it has to equal a bigger problem. Well, today we're going to put one of those exact assumptions right under the microscope.
So, here's the question. Autism plus ADHD? Does that equal double the risk? It just seems like simple math, doesn't it? If you have autism spectrum disorder, and on top of that, you have ADHD, does that automatically crank up your risk for something like internet addiction? It's an idea that makes a ton of sense on the surface, and we're about to find out if it's actually true.
Okay, so first things first. Let's dig into why this idea makes so much sense to so many of us. We're going to build a case for why this assumption seems so logical.
All right, before we go any further, let's make sure we're all on the same page. When we say internet addiction, or IA, we're talking about something pretty specific, a compulsive, out-of-control need to be online that gets in the way of real life. And this isn't just a made-up term, The World Health Organization and other big groups are now formally recognizing things like gaming disorder, which is right in the same ballpark.
And this is where the logic really seems to click into place. On one side, you have autism. That tendency to get really deep into specific interests can make the endless content online almost magnetic. Plus, the online world can just feel safer, more predictable than messy face-to-face stuff. Then you bring in ADHD with its classic traits of impulsivity and that craving for instant gratification. The internet is practically designed to feed that with constant pings and endless novelty.
And okay, here's the kicker. A huge number of people, we're talking 40 to 70%, who have autism also have ADHD. So you can see why everyone just assumes, well, of course, you put these two things together, both with their own links to internet addiction, and the combined risk has to go through the roof. It seems like a no-brainer.
But what if it's not that simple? What happens when you stop assuming and actually look at the data? Well, the answer is pretty surprising.
So a 2025 study decided to put this exact idea to the test. They took a group of 164 hospitalized adolescents and split them up. One group with just ASD and another with both ASD and ADHD. Then they measured their symptoms of internet addiction. So what do you think they found?
And bam, here's the first big surprise. Just look at this. The two bars are almost exactly the same height. Whether a kid had just ASD or both ASD and ADHD, their internet addiction scores were basically the same. Our whole additive risk theory, it's already starting to fall apart.
Yep, the numbers don't lie. Adding an ADHD diagnosis didn't seem to crank up the problem overall. But, and this is a big but, that flat average is actually hiding something much more interesting. The real story is buried in the data.
See, the researchers realized that looking at everyone together was blurring the picture. The real story, the one that matters, only popped out when they sliced the data in a different way, by sex.
And just like that, everything changed. This one simple thing, splitting the data between boys and girls, uncovered a totally different pattern. One that completely flips our initial assumption on its head.
Okay, so first up, let's look at the boys. For them, the story was pretty much what we saw in the overall group. Whether they had ASD alone or ASD plus ADHD, their scores were super similar. Nothing really to see here, no big difference. But then you look at the girls, and whoa, the whole thing flips upside down. And this isn't just a small change, it's a statistically significant one. For girls, the group with ASD only actually had higher levels of internet addiction than the girls who had both conditions. Let that sink in for a second. It's the exact opposite of what we all thought.
Okay, so if adding an ADHD diagnosis doesn't automatically make things worse, and for girls it might even be linked to lower scores, then what in the world is actually going on? What really matters? Well, the study points us away from the diagnostic labels and toward real life.
For the boys in the study, it wasn't about the combo diagnosis. It was about other things in their lives. Two big ones jumped out: struggling with school attendance and coming from a lower socioeconomic background. Both of these were linked to higher internet addiction scores. It's about their environment, not just their neurology.
And for girls, a completely different set of life experiences mattered most. Being a victim of bullying, that was strongly connected to higher internet addiction. You can totally see how the internet might feel like an escape, right? But here's something fascinating. being on medication was linked to lower addiction scores. That suggests that getting treatment for the underlying issues can actually help protect them.
All right, let's pull all these surprising threads together. What's the new big picture we're looking at now that our old assumption has been busted?
The researchers who did the study said it best. They suggest that maybe we're thinking about this all wrong. Maybe ASD plus ADHD isn't just autism plus ADHD. Maybe it's its own thing entirely, a unique neurodevelopmental profile with its own set of characteristics that you can't get by just adding two things together.
So what's the bottom line here? It's that the label isn't the whole story. Not even close. Sure, a diagnosis is a useful tool, but the real factors that shape a person's risk are found in the details of their individual life. Their sex, their social experiences like bullying, their school life. That's what really, truly matters.
And that just has to make you wonder, right? If we can't just stack diagnoses on top of each other like building blocks and expect a predictable result, what other common sense rules in mental health are we getting wrong? What else do we need to start rethinking by looking past the labels and really seeing the person?